Hi, Assalamualaikum. With me again, teacher Aisha. So today I'm going to present about the echolalia. Okay, so what is echolalia? Echolalia is a speech disorder characterized by the repetitions of words or phrases that have been heard from someone else. Common in children who are learning to speak, but it can be symptoms of certain neurological disorders such as autism spectrum disorder. So echolalia can be immediate or delayed, or echolalia can be classified into two categories, which is functional, which is the interactive and non-interactive echolalia. Okay, just now I have in definition had mentioned about the types of echolalia, which is immediate, delay echolalia, and also interactive ataupun functional or and non-interactive echolalia. So this set is going to describe about immediate versus delay echolalia. So the in immediate echolalia refer to echo immediately after they are heard. So they might echo the whole or part of the phrases. So immediate echolalia has a variety of purpose. First one is to process the language, thinking about the language used and commit the language to the memory. So this is the immediate. Immediate is basically when the persons ataupun a children have echolalia, which is repeated immediately. So for example, they have see ataupun heard someone talk like what is your name, so they are going immediately say what is your name. Okay, so this is immediate, which is cepat-cepat they do. So why they going to immediate? This is because they have a time which is the processing the language, which is they are going to process the terms in verbally. So that's why they are thinking about the language use. So because of they are thinking, so they are verbally talk the sentence. They are not because they are not controlling in the mind, so they are going to control it verbally. So that's why it's commit the language to the memory. So this is one way they want to memorize the language ataupun memorize the sentence ataupun memorize how to questioning the sentences. So they are going to verbally echo. So next one is a delay. Delay echolalia is referred to the repetitions of words or phrases heard that are echoed after the fact. This could be minutes, hours, days, or months or week later. Delay echolalia also serve a variety of purpose. First is serve as self-esteem, communications, dysregulations, and last one is meaningful gestalt tied to an emotion experience. Okay, so delay is a delay as tengok words ni delay, which is dia akan to echo, they are going to repeating the same thing in take a few hours, also in a week also. So they are going to use this echolalia as a self-esteem, which is to calm her day, and also communicate this regulation, which is they are cannot interpret what the sentence and what the meanings of the words itself, and also can be meaningful gesture, which is they cannot be integrate what they are going what meanings of the sentence and also what the phrase is it. So this is because they are going to echo in their mind and echo in their verbally. Okay, next one. All right. So next is the interactive versus non-interactive echolalia. So in interactive, when a child repeats words or phrases with the intentions of communicating with others. So this is a clarifications to express their needs. So di sini in interactive echolalia is a thing that they need to macam mana, it is a benda yang perlu ada ataupun untuk mereka communicate. Okay, benda ni echolalia has as a as as a cara untuk mereka communicate with others. So this is intention, which is dia ada sebab why they have a echolalia in that time. So for the non-interactive, when a child repeat words or phrases for reason others than communication. Example, repeat a phrases from TV show or a song without any intentions of communicating with others. So this is a verbal. This is a eco this is echolalia yang tak perlu ada pun untuk dia, because they are continuously talking, continuously bercakap, which is echo, with ignorance, which is they akan ignore what we going to talk with him. So this echolalia for non-interactive is sebagai penghalang dia untuk terima input baru, which is terima a question baru untuk mereka integrate in your mind. So this is which in a simple words is not good in echolalia lah. So this one non-interactive need to be break for some from the therapies. Okay, before we going into the causes, the first one we need to know that the echolalia is unknown causes ataupun unknown reason that can lead to the echolalia. Okay, the main point dia lah. So this is idiopathic. Idiopathic is unknown. Okay, next one, the echolalia, the repeated speech normal, which is kita dipanggilkan normal bila seseorang itu repeating the sentence, the words dalam umur 3 tahun ke bawah. Bila 3 tahun ke atas, dia start to be improve ataupun goes away the repeating words. When it become more than 3 years old, they will be diagnosed in echolalia. Okay, so this is underlying condition lah. So when a person who had a repeated words, repeated sentence, okay, so they might be diagnosed as a echolalia. Okay, this is some of causes. The first one is autism spectrum disorder, which is ESD. So as we know that echolalia ada dua jenis tadi, interactive and non-interactive. So why because of the causes of the echolalia is some when a person who ada autism, dia menggunakan echolalia tu ada dua. Satu, one of the way they are going to communicate ataupun to integrate the sentence ataupun the words. And the second one is going to be escape lah. So escape, they are going to echolalia, which is not interactive, which is they are going to escape the continuous verbal echolalia. So next one is ADHD. So ADHD is attention deficit hyperactivity disorder. So this become hyperactive lah. So when they are hyperactive, the brain also hyper to works hyper to work, so that they are going to verbally can be from brain they are transferred to the actions, which is mouth also the action, mouth also action, so they are going to actively talking. So bila actively talking ataupun actively integrate maklumat, so they are going to might be the echolalia. So this is one of the causes boleh melidkan dia untuk jadi echolalia. Okay, next one is aphasia. Aphasia is a condition characterized by partial or total loss of the ability to communication, verbal or using with the words. So this is bila mereka ada something yang unable to speak, to write, so they are going use echolalia as thing that can be memorized. Macam kita guna tadi in delay echolalia, which is they are menggunakan bila mereka tengok TV, so dia orang menggunakan satu sentence tu, dia orang mengingat dalam masa waktu yang lama. So they use echolalia to learn ataupun to memorize something. This is aphasia. So they can be cause the echolalia. So the next is head injury. Head injury is because of the Kalau kita kata head injury, dementia, development delay, they can be boleh jadi sebab-sebab because of the brain. The brain control, kan brain can control all the activity of the body, the movement, the activity daily. So dekat sini bila ada tiga benda ni, which is the developmental delay, head injury, dementia, is something wrong in the brain yang menyebabkan mereka Echolalia. So this dia cakap the if the brain is problem, so there can be problem also in verbally, in writing, in how they are going to interpret, how they are going to cakap semua. Okay. Same goes to the encephalitis. Encephalitis is inflammations of the brain. So it might be kacau juga perkembangan otak yang menyebabkan cara ataupun interpretations from brain to actions, which is the mouth. Okay, are going to kacau the flow, how they are going to talk. So Tourette syndrome. Tourette syndrome is, as we know, that one of the clinical features is repeating. So this is might be seen as a echolalia. Okay, the causes yang tadi kita mention tu can be examined by the first one. Researchers believe this symptom happen due to the frontal lobe dysfunction, which is yang kita cakap tadi. There are a lot of one of the macam some of the causes tu because of the brain development. Bila dia kacau brain development, so they are kacau the flow, how they are going to interpret, how they are going to verbally and actions. Okay, so researchers believe the part of the brain which is the frontal lobe dysfunction. Okay, bila kita tahu the frontal lobe is can the brain area that manage thought, movement and memory. Okay, so what apa yang akan mengacaunya bila the frontal lobe dysfunction? The first one is dopamine dysregulation theory. During so the doctor ataupun the researchers ataupun the examiner will use the dopamine dysregulation theory. So when too much or too little dopamine, a brain chemical can affect the way your brain tell your body how to communicate. Okay, next one they are going to use broken mirror neural theory. Specialized neurons, the cell in brain, are not working as expected. So next one, a wealth of stimulus hypothesis. These are disconnect between what they learn and how their body respond to it. Speech. Okay, so tiga benda ni ada dekat frontal lobe. So bila frontal lobe dysfunction, they are going kacau this dopamine, the amounts of dopamine, the amounts of the neuron, and also the amounts of the stimulus hypothesis. Okay, the next one, risk. So risk factor. Bila kita tak ada treated of the echolalia, apa akan jadi pada certain people who had the echolalia? The first one, they are going to anger, frustration, and stress. Okay, next one is barriers to learn and education, social isolation, difficulty forming relationship, and anxiety and depression. Okay, next one, who will be treating the echolalia? The first one is neurodevelopmental specialist, therapist, speech language pathologist, psychologist, and special educator. Okay, that's all from me. Thank you.